Hey, this is Jason Erickson here at Egan Massage Center, and along with my partner and model Beth Ivy. And then next year I'm going to be co-teaching seminars with Walt Fritz, and he and I are going to be bouncing back and forth on biopsychosocial models of therapy, myofascial release, and dermal neuromodulation, and also movement-based therapies. Where some of the things we're going to be talking about are not only like the narratives behind the work that we do, but like what are we looking at when we're assessing people? If we open up Beth's hand and we go to extend her wrist, or we go to flex her wrist, and then we close her fist, and then we go to extend her wrist or flex her wrist, like, do we notice differences in the passive range of motion? What if we tested her active range of motion? What are we looking for with different types of assessments, and why are those relevant? And how are those meaningful to Beth, and how are those meaningful to our clinical reasoning? So I'm looking forward to seeing you at our seminars in Olympia, Washington, or St. Louis, Missouri next year. And hopefully we'll all have a great dialogue that's going to involve a lot more than just wiggling wrists, but also hopefully helping to get those wrists moving and feeling more the way that they should.
Hi, this is Walt Fritz. I'm here with Jason Erickson at his clinic here in Minneapolis. He and I sat down together for a couple days here to put into motion a new workshop that he and I are teaching next year, 4-day class that combines DNM and MFR and pain science, and human interaction is really what it comes down to from a biopsychosocial perspective. I am here with Beth Ivy, who's been our demo model here for a few of these little videos here, and I'm showing, in essence, one of the techniques, if you will, that we're going to be covering in the class. But the class is going to be a lot more than just a bunch of techniques. It's going to be about how we frame techniques, how we communicate with the patient, how we share and exchange and kind of deal with the demons of the things that we've been taught in the past and things that people are saying are happening now. So I've got Beth in one of my favorite places to treat people with neck pain, which doesn't imply that this is useful or helpful for her. We're going to try it out, but Beth, what do you feel right now?
Well, I feel the base of the palms of your hands putting pressure along the occipital ridge of my skull, and I feel a stretch going up through my erector spinae.
Great. Now, Beth gave me what a lot of patients will tell me. It's like they'll tell me anatomy, but I don't know if that has any meaning to her. Is any of this familiar? Is it what I'm eliciting, you kind of tapping into the reason why you would come and see a therapist?
Well, yes and no. I mean, I do feel a good stretch in my neck, and I feel like there are muscles that are being touched that have never been touched before. But the pressure on the base of my skull, after a while, I don't think I'm going to like that.
Yeah. So how about if I backed away a little bit?
Oh, see, now that's better.
Yeah.
Yeah.
So it feels a little bit more tolerable for you.
Oh, yeah.
Right? Okay, so I'm in a tolerable range. I'm going to try not insert my beliefs on you, but does this feel like it might at all be useful or helpful?
Oh, absolutely. Definitely feeling that stretch.
Yeah, so this is tapping into familiar aspects of perhaps your pain?
Yes.
Yeah, good. So what you just saw in a nutshell there is how I approach my patients. Instead of me telling them what's best for them, it's a negotiation. It's a partnership that my patients and I are constantly working toward. It's a lot of work for both me and my patients, but I think it's really good work, and this is just one small aspect of hopefully what Jason and I are able to cover in this class in Olympia, Washington, and St. Louis, Missouri in 2020. Stay tuned for more.